I'm Beau Kilmer, and I co-direct the RAND Drug Policy Research Center. In the United States right now, you've got 8 states plus Washington, D.C. That have legalized marijuana for non-medical purposes. More than 20% of the U.S. population lives in states that have removed the prohibition on marijuana, but also allow for-profit companies to come in and begin producing and selling marijuana to adults 21 and older. This is still all illegal under federal law. And in fact, it's not entirely clear what the new administration is going to do with respect to marijuana. The federal government has a number of options. One, it could try to crack down on the industry. Two, it could try to use its discretion to shape the market. For example, maybe not try to crack down on the entire industry, but maybe focus its efforts on trying to stop those firms that are advertising, or maybe go after those firms that are selling high-potency products. A third option is that it could kind of continue with the status quo. Fourth option is to reschedule marijuana in the Controlled Substances Act. A fifth option would be to keep it federally prohibited, but try to resolve some of the conflicts, for example, with respect to banking. I mean, you can keep it illegal at the federal level, but still try to solve this banking issue. There's also, it would also be possible to create a policy waiver system where states would then engage in formal agreements with the federal government that the federal government wouldn't interfere in their states with respect to marijuana. For example, as long as the state was was doing a good job of trying to keep marijuana from being exported. This is important because if with a policy waiver system, it would make it a lot easier for states to to experiment with some of these middle ground options, such as allowing a state monopoly. And the sixth option would be to legalize. One of the things to keep in mind when you're engaging in discussions about marijuana policy, and especially legalization, that there are going to be trade-offs. There are some individuals who, if their main goal is they want to reduce the size of the illicit market. Well, if that's your main goal, what you would do is you'd want to, allow for a lot of supply and not have a lot of regulations, and try to push out all of the illegal producers. Now, for those on the public health side, there's some concerns that, the public health folks, they want to regulate these products. And then there's some people that come at this debate that say, I want to reduce the size of the illicit market and I want to protect public health. Well, in that case, there's going to be some trade-offs. For example, if you decide that you want to initially limit the sales of high-potency marijuana products, there may still be a black market for that if you prohibit it. But at least you necessarily wouldn't see it in the stores, or wouldn't necessarily be marketing for that. So there would be some trade-offs there, and it's just important to acknowledge those if you want to engage in productive discussions about marijuana.